Hello, this is my second video for my reflective topic number 3. And before I start taking you through my journey, canoeing through the Kichisipi and achieve the truth and reconciliation using the great rivers of reconciliation, I would like to also explain you a bit about how I will achieve this path through of truth and reconciliation based on the TRC calls to action. So I will create a dementia inclusive training using an Algonquin and Anishinaabe perspective for healthcare students. And fundamentally, I have used the two TRC calls to action 22 and 24 because I feel that the number 22 is it's a way of changing Canadian healthcare system to recognize Aboriginal healing practices, especially focusing on the collaboration of healers, Indigenous healers, and elders as requested by Aboriginal patients. But in addition, I think also it's part of my perception is that I should also you should also follow call to action 24 is to call upon medical and nursing schools in Canada to require all students to take courses that implement or help dealing with Aboriginal health issues, including history, legacy of residential schools, United Nations Declaration on the Rights of Indigenous People, treaties and Aboriginal rights, and also to train to develop different skills and training in intercultural competencies, conflict resolution, human rights, and anti-racism. So those are the two main TRC calls to actions that I will use in this reflective topic. Talking a few words about dementia perspective and dementia in healthcare providers. Traditionally or usually there's a lack of general training and education in healthcare provider about dementia, Alzheimer's disease, and other type of dementia. And people with dementia and their families identify the need of healthcare professionals to be competent enough in tailoring care for the individual patient in a truly person-centered approach. So talking about person-centered approach, there's a lack also of training with an Indigenous perspective, and healthcare professionals need an Indigenous perspective to provide a culturally safe dementia care and address inequalities and also understand the Indigenous perspective of aging, prevention, dementia prevention, and also aging well as understanding on an Indigenous perspective, healing practices, and also the behaviors and psychological symptoms of dementia in a person with dementia from an Aboriginal or an Indigenous community. So, in addition, these days we know more that there's a movement called dementia-friendly communities or even dementia-inclusive communities that is also a call to action to increase awareness and understanding of dementia, increase social and cultural engagement of this person with dementia, and also go through inclusion, increase capability, and take actions to improve the physical environment, take actions to also develop better services to respond to the need of this person with dementia. So on that note, I have developed something called the Great Rivers of Reconciliation, and this is my path to truth and reconciliation based on the TRC call to action 22 and 24. As you can see here, this is sort of like a concept map, and it's been designed or thought on an Indigenous Algonquin and Anishinaabe perspective, since the rivers are so meaningful for the Anishinaabe Algonquin peoples, and also the Kichisipi, which is the big river. The Kichisipi River is the river that we will go through to reach our target, our destination, which is the truth and reconciliation. As you can see in this in my on the Great Rivers here on my chart, we can see that going through the Kichisipi involves all the steps that I went through with the reflection number 1, such as Master of Healthcare Professional Enrollment, National Day of Truth and Reconciliation, my perspective on indigenous cultures, personal biases, and also positionality, understanding First Nation, Inuit, and Métis, understanding reconciliation, the school system, cultural safety, the colonizing my practice. And that gets into reflection number 2, which is more apply. So it's pretty much talking about learning indigenous knowledge, indigenous pedagogies, cultural humility, Anishinaabe Algonquin perspective. I also connected with the Algonquins Great Golden Lake First Nation. And they taught me also some thoughts about the elders, the Good River Road, for example, and also sacred storytelling and stories that we could use as a way of understanding the indigenous perspective of aging well. And then we get to the TCR call to action 22 and 24. Then we understand aging well with an indigenous perspective, well-being through an indigenous lens, brain health through an indigenous lens, dementia prevention, dementia inclusion, and also healthcare students. So now we are here at reflection number 3, which is to create and emphasize the action to create based on the TRC call to action 22 and 24, and create and develop a dementia inclusive training for healthcare students and apply those knowledge to improve the healthcare knowledge or the dementia providers' knowledge with an indigenous perspective to treat, to understand elders and persons from the indigenous communities, patients from the indigenous communities, also perspective on dementia, aging well, dementia prevention, and also dementia symptoms, and also having in mind the intergenerational trauma and the residency schools also as an important fact. So navigating through different rivers here, we can see that we also have different rivers that go in different directions or in just one direction or both directions, but we can also say that one river also goes through health, education, justice, the TRC report, the Lancet Commission on Dementia Prevention and Care, the Alzheimer's Disease International Report from this year, 2022, the Canadian Dementia Strategy, the Indigenous Cognition and Aging Exchange. That's one of the river. We have also an quite important river, for example, the colonization, the Northwest resistance, residential schools, the Indian Act, intergenerational trauma. In another river, we have language, cultures, First Nation, Inuits, and Métis, and ceremonies, medicinal plants, intergenerational trauma, and elders. In another river, we have also things that really goes in another direction or help. They don't help to provide us or to reach to the point of truth and reconciliation. And those are colonialism, racism, ignorance, discrimination, exclusion, resentment, and structural violence, for example. As well as I would say that Western perspective has, we could say there's that transition between Western perspective and the indigenous perspective. So I would say it's kind of a mix of directions here. So these are my thoughts about how we can achieve the path to truth and reconciliation based on the TRC calls to action, and also include my own path through the Kichisipi. And I want also to say that this is based on my thoughts, on my reflections, and also it comes from my imagination, but I think is inspired by different stories and comments and thoughts about the elders and the Algonquins and Anishinaabe peoples, especially the Algonquins or Great Golden Lake First Nation. So I developed this, the Great Rivers of Reconciliation as way of understanding in a very graphical way, as a concept map, all the steps that I went through and all the things that could be in our mind when we talk about reconciliation and truth and reconciliation, and when we talk about the TRC call to action.